Hi, I'm Shan.
And I'm Josephine.
We're medical students from AMSA IMU, bringing you the 6th episode of Trust Me, I'm a Doctor. Almost. For this episode, the theme is the human body, specifically the feet, with the title being, Ugh, my feet hurt. We'll be discussing everything about orthopedic surgery, specifically ankle and foot surgery.
So just a disclaimer, as mentioned in the title, we are not doctors. This is just our way of sharing our personal opinions whilst speaking to certified, experienced people from their fields. So if you do have a medical condition, please do not take our podcast as medical advice and seek professional help from real doctors. So with that being said, thank you, Dr. Low, for accepting our invitation to have a conversation with us today. For our viewers, Dr. Low is one of the few orthopedic surgeons who specializes in foot and ankle surgery in Malaysia. He graduated from National University of Singapore in 1988 and completed his fellowship in both Seattle and the NHS. He also has been actively involved in educating the community through being a guest lecturer, peer reviewer, and other learning activities. Dr. Low is currently practicing as a consultant orthopedic surgeon in Kuala Lumpur Sports Medicine Centre and Gleneagles Hospital, Kuala Lumpur. So, Dr. Low, would you like to give a brief introduction to our listeners here today?
Well, thank you once for having me here. I think, I work in the private sector. I've been there for the last 18 years. I actually work at a center, KL Sports Medicine Centre, which is, I think, one of the largest physiotherapy centers in the world. In the Klang Valley. So I think, and that actually does play a role in my work. And I would say that it's all about teamwork, actually.
Okay, thank you so much, Dr. Low. So, as a medical student for the past 2 years, I know what an orthopedic surgeon is, but it's my first time seeing a surgeon who actually specializes in foot care. So I would like to know a little bit more about your work and your role in this field.
Well, it's what I do. I'm an orthopedic foot and ankle surgeon. I started off, first of all, as an orthopedic surgeon, but I decided to subspecialize in just foot and ankle surgery because you need to go further into depth. And then actually that's where you handle the more complicated cases. And also you are at the forefront of the research that is ongoing for even some of the more common conditions and how we know about ways to improve the treatment and the outcomes of these conditions. So that's, I think, my role.
I see. So, wow, I don't think we really grasp what you just said, honestly. So you do research and you also believe that subspecializing in this field makes you be able to go more in depth into orthopedic surgery in general.
That's true.
That's what you're saying?
Yeah.
Okay. So then, one thing that I notice a lot of people ask about orthopedic surgeons is whether or not we should be regularly consulting an orthopedic surgeon. What do you think about that?
Okay, well, my answer to that is this. As what it says, orthopedic surgeon is a surgeon. That means you should see a surgeon if you have a condition that needs surgery. I mean, it's as logical as that, isn't it? But I think in this country, or rather in many parts of the world, even that line, that boundary isn't very clearly drawn out. There are some conditions that actually do not need surgery. And I guess in a way, sometimes it takes a surgeon to be able to tell you that. If you're a non-surgeon, you may know, you may think that it need not be treated surgically, but then you also have to see the full spectrum of the disease or the condition. That actually some may need surgery, some may not need surgery. I give, for example, a common condition I see now and then, flat foot. Certain conditions, at the milder level, you actually do not really need surgery. It's not absolutely necessary. But at a later stage, as things get worse, I think you will come to a point where, yes, then there is actually very few other options if you want an improvement to have surgery. And the basic principle is this. That's why I feel that one thing I like about my work, it combines medicine with a bit of engineering maybe and a bit of actually a better understanding of biomechanics. So a lot of conditions that actually need surgery are those that have had significant biomechanical abnormalities.
Would you say that your pool of patients would be like people who are more active in sports, or usually it's like the older generation since it's, more wear and tear issues?
No, actually, my range of patients is everything from the young to the old. I do make it a point, though, I do not take patients below the age of 9, because there's actually another branch of orthopedics called pediatric orthopedics that handles them. And they are better suited seeing these doctors. But my patients include everybody in between, from teenagers to even students like you all. I've had a few. To sports people, to even weekend warriors, we call them. And further down the line, and the one that sometimes really takes a lot of commitment, are those patients with chronic illnesses, because these are going to be long-term patients, patients with diabetes. And, I'm sure you all know that, in Malaysia, in this country, I think the incidence of diabetes has soared tremendously. In fact, I noticed as I was coming in, you have a big sign there that says you have a diabetic clinic here or something.
Oh, yeah.
I think that shows that at least, at IMU, you all understand the importance of diabetic care. So foot surgery, actually, you could say, is a further extension of those patients who have diabetes, who actually need further care in that area. So yes, my range of patients is really very wide in that sense.
Thanks for telling us. We've actually had a question about diabetes and how it affects the foot and how your role plays into that part. So could you give us a little explanation of what?
I hope I don't end up giving you a lecture.
Oh,
no. But very, very briefly, I mean, diabetes affects the feet, especially in a few ways. One is, of course, in a really bad case, the circulation is going to be impaired. Some patients have a lot of, stenosis of the vessels, so the blood supply isn't that good. Second problem is sensation. A lot of patients lose sensation in their feet. In fact, I would attribute that to probably the most important factor in causing foot problems in diabetics. And the third one, which is very interesting, is actually because diabetes causes some muscle imbalance. Some muscles actually weaken, some become tight. And if you remember your anatomy, there's this muscle called the gastrocnemius, which is one of the calf muscles, which in our field, we recognize as one of the common problems, or the common source of the problems that causes, biomechanical abnormalities in the foot that then leads to a lot of problems. Like diabetic ulcers is one of them.
Okay, so by biomechanical problems, could that lead to like flat foot also?
Yes, it does. It does. In fact, biomechanical problems cause a lot of the problems that I see. Flat foot, well, what commonly is known as bunion, but if I'm speaking to medical people, we should use the proper term, hallux valgus. Okay, and there's another type of problem called hallux rigidus. That's all related to these biomechanical problems. Even some patients have frequent ankle sprains. Now, ankle sprains, there are also many causes, but one of them is also if the patient is inherently unstable biomechanically.
Oh.
So, yes, these are the things. Yes.
Depression?
Like what? Sorry?
Like in mental
health?
No.
Unstable biomechanically. Biomechanically unstable.
Oh, like having disabilities.
Well, you see, I give you an example.
Yeah,
if you have, you know what is flat foot?
Yes.
Right? You know the opposite of flat foot?
High foot.
High arch. Okay. As I said, it's going to sound like a medical lecture. Pes planus is flat foot. Plus, the opposite is pes cavus, a high arch. Now, throw in some more medical terms. I'm sure your audience will understand that. In a flat foot, your foot is actually pronated. All right. In a high arch pes plus cavus, your foot is supinated. It's turned the other way. And a supinated foot, if you go and supinate your foot right now, as I look at you, you will realize that actually you are about to actually go into an ankle sprain. And some, but not all of my ankle sprain patients, and those who tell me they have had it repeatedly, have a very high arch. So if you don't recognize that, you again, that's where you know your treatment may not be really able to tackle the source of the problem. Which is why I say in our field, foot and ankle surgery, understanding the biomechanics is very important.
Doctor, I have a question. So we are talking about, high arched the feet and then flat feet. So I realized that there's a lot of shoe companies that actually market themselves as being beneficial to, these kind of things. They tackle this and it's good for the patient or the person buying. So is it actually really beneficial, or is this some sort of like promotional idea?
Shoe
Capitalism.
companies have to market their product, all right? And so they will naturally want to highlight what are the advantages of using their product. But I think, that's why I would not say endorse a specific brand or product, but I would actually endorse specific features in some shoes. Without having to mention the brand names, I'm sure you realize, for instance, some shoes have a better arch support, even sandals. See, some shoes have a broader heel. If you are recovering from an ankle sprain, your heel is actually a bit unstable and wobbly, you'll feel better wearing a shoe with a broad heel base. Especially for the ladies, if you wear stilettos, it's more difficult. Why? Because you have that very narrow point that you need to balance yourself on. And then another type of shoe, very interesting, are those with what's called a rocker bottom. See, a rocker bottom allows you to roll on the foot as you walk. So again, that has certain biomechanical advantages. And again, I don't actually endorse a specific brand, but I actually encourage or I specify that feature, which I find is beneficial to the patient.
Yeah, that's a really helpful way to put it. That's actually what we were about to ask you next. It was like, how would you recommend somebody to choose proper footwear? Because from what I'm understanding, everybody seems to have a different kind of foot.
Absolutely. Well, truth be told, let me say this. If you have ever traveled overseas, one complaint I have with our local shoe retail business is that they are not as sophisticated as the ones you see in developed countries. If you walk into, say, you go to Australia, you walk into a shoe shop, you not only get to choose the shoe size that you want, the shoes come in different widths. If you go back after listening to me, go back and look at your feet and measure, you'll find that each one of you may have different length of the foot and different width. But if let's say two of you have the same length of the foot with the same shoe, but you have different widths, would the same shoe fit you all? Actually, the answer is probably no. And so you actually have to find a brand or a shoe that has a wider shoe for if your foot is wider. And in fact, the other feature I will tell you is this: laces. Our Malaysian habit is people like to buy shoes that are a little too big. Why is that? Because then it's easier to slip it on and take it off. Okay? But actually, if you have a shoe with a lace, my advice to patients is to tie it snug enough. I didn't say tight, I just say make it snug so that even if the shoe is a bit bigger, your foot doesn't slip inside the shoe. Because then let me tell you about two common problems I see as a result of people not wearing their shoes correctly. One is actually, the people call it the black nail, where the toenail gets black.
Yeah.
You hear that, especially if you talk to your friends who have gone hiking, they're coming down, say, from Kinabalu. If they didn't tie their laces tight enough, their foot will just slide inside, and the big toe, the nail will hit the inside of the shoe and cause a subungual hematoma.
Oh.
Okay. The other problem is this. So very common, if your shoe is fitting you poorly and your foot, the tip of your big toe is sliding around inside, you cause another problem, which is also very common. I'm sure you all have seen it. Ingrown toenails.
Oh.
It's very painful.
It's very painful, but actually all this is avoidable. And actually part of my work is, no doubt there is a surgical treatment for this, but actually more important, I feel, is to educate patients on, first of all, choosing the right shoe, teaching them how to wear the shoes correctly. And I think just as important is even cutting your toenails.
Mm.
What do you use to cut your toenails?
The toenail clipper.
Yes. You need a toenail clipper, which is different from the clipper you use for your fingers. Because if you look at your own fingers, the curvature of your nail is much more. Your toenail should almost be straight. So a common mistake people make is they use the nail clipper for their fingers to cut their toenails, and as a result, they leave a spike of nail buried under the skin. That's how they end up with an ingrown toenail.
This is
wow.
quite new to me.
Yeah, we learned something.
I told you this is going to turn into a lecture.
I mean, it's very informative and it's actually interesting. So thanks so much for that. Yeah.
Doctor, besides, shoes, is there anything else that would affect, your ankle and your foot? Maybe like posture, or maybe like the types of clothes you wear?
Clothing, not so much, but yes, posture, very, very true. If any of you are into physical fitness, which I hope most of you young people should be, one of the things you learn to do is to develop your core muscles. You know the muscles, again, another anatomy lesson, okay, your rectus abdominis, your erector spinae, your lumbaris muscles and all that. But guess what? The foot has similar muscles.
To your core?
That function the same way as the core. I remember during my first year in anatomy, I hated that part where I have to memorize the names of all those little muscles there. I gave up, actually, to be honest. And, what I know today compared to what I knew then is a lot more. But let's simplify things a bit. Those muscles in the foot, if you look at the underside of your foot, those are called the intrinsic foot muscles. And guess what? They actually control the position of all the bones in your feet. 26 bones and 33 joints in your foot, just to revise your anatomy again. And can you imagine each individual joint and each individual foot, actually, those muscles all play a role. And I myself see a trend. Patients or people who are quite active, they have good, strong, intrinsic foot muscles. Okay? And therefore, they actually have fewer problems. People who don't exercise that much, or perhaps they're not aware of the importance of these muscles, they actually do end up with more injuries in the foot. So, in fact, as part of my treatment plan, I refer my patients, and I really, as I said, I'm very blessed with a very big physiotherapy department where I work. My physiotherapists will actually do a very good job of training them to strengthen their intrinsic foot muscles to improve the way the foot functions. I know you're a physiotherapist in IMU. You should go and talk to them.
We do? I did not know that. Well, thanks for letting us know. Now we know. But yeah, talking about rehab, I mean like physiotherapy, right?
Yes.
So, in any ankle injury or foot injury, like you were saying, we need physiotherapy. So what can our patients or people who are going for physiotherapy expect in this kind of sessions?
A lot of hard work. A lot of torturing. But, I kid you not. Some of my patients hated it, but some who knew it helped them, actually is very heartening to know they develop a good relationship with my physiotherapist, and they say, okay, they attribute their recovery. And I say, look, it's true. They attribute their recovery more to the physiotherapist who helped them, took them through all the series of exercises that actually help them to improve their function. And let me say this also. You see, that's why I said at the beginning, an orthopedic surgeon is somebody who does surgery. And I think, to be honest, even speaking for myself, I started out, most of us were trained only to do surgery. And at that time, we didn't really see the benefit, or rather, we didn't sort of realize the role that physiotherapy has to play. But over the years, partly because I work very closely with my physiotherapists, I see the work that they do. I began to actually interact with them, and we exchange ideas. And I encourage you all to do the same. Go and talk to your physiotherapy students. Last year, I met a professor from Imperial College of London who actually validated this perspective. Now, just imagine, he's a professor of foot and ankle surgery in London. And during his sabbatical, he told me he took 3 months off to go for a course in physiotherapy. He changed a lot of things that he did in his treatment of patients. So, for instance, he gave a very good talk about, Achilles tendon ruptures. You all know what happens when you rupture your Achilles tendon. And the title of his talk was very interesting. He said, "More rehabilitation, less surgery." What he was actually saying is that while we can actually do surgery to repair a ruptured Achilles tendon, but you need a lot more of rehabilitation in order to get back the full function and recovery of the patient. So if you see, this is one of the misunderstandings a lot of people have. They think that, just do the surgery and that's it, you're fine. But actually, no.
So will you say that this is an issue in Malaysia? Like, people aren't realizing the importance of physiotherapy after their surgeries and whatever?
Yeah, I think, I would say it's growing. It's not to say that we don't understand. We do actually have patients who go directly to the physiotherapist without seeing us doctors. But to which I would actually caution. Caution, because unfortunately, a physiotherapist is not trained to make a diagnosis. Next time when you have finished your training, you are qualified to make a diagnosis. But because you didn't do physiotherapy training, you do not know how to administer physiotherapy. But your friend who's a physiotherapist will know how to do all those various modalities like stretching, ultrasound therapy, electrotherapy, but they are not in a position to make a diagnosis. So that's where your two roles complement one another. The doctor makes the diagnosis and prescribes the type of physiotherapy. The physiotherapist, with the doctor's diagnosis, can then administer the correct or the appropriate type of physiotherapy for the patient.
Okay.
So is it that all surgeries would require physiotherapy afterwards?
In general, yes. Actually, yeah.
So
I would say that.
So if a patient comes out of surgery and then they have to do physiotherapy, how long would that usually take? Is this like a lifelong thing where they have to maintain, or is it for a couple of months?
That's a favorite question a lot of patients ask me also. And my answer is this: it depends on how determined you are, how disciplined you are. I have patients who, due to work commitments, they can't do that frequent. I have patients who really, to them, getting back their fitness is everything. So they work really hard. I have patients who, one of my patients whose Achilles tendon I repaired, he was back playing football 4 months after surgery. But I have another patient who, due to work commitments, couldn't come as frequently. The patient took a year to recover. Then remember the professor from London, I told you about, he treats English Premier League football players. And to get these people back to fitness for playing, it takes 9 months. Yes, that's why the answer to your question also, it depends on what level you expect. If you are, say, you are just an average office worker, let's say, probably just a few months of physiotherapy will be enough for you. But if you injured yourself, you had an injury, you had to go for surgery, and later on you want to climb Mount Kinabalu, I'll tell you, you have to put in a lot more effort.
So the more rest you have, the faster you heal?
Oh, no. That's not more rest. In fact, again, that's one of the misconceptions I feel that I want to sort of share with you all. For example, I still hear this being told to people: you sprain your ankle, you should go and rest. Actually, to me, that's not right, because my policy is, I see a patient with an ankle sprain, I assess the severity. As I said, sometimes some may be very mild, some may be very severe, but a large percentage actually do not need surgery. And then once I assess them, they can actually start physiotherapy right away. And they find that they recover a lot faster than those patients who rested, because what happens when you rest, your muscles within a matter of weeks begin to atrophy. Once it atrophies, you're going to have a longer, time needed to actually regain back that muscle strength.
Just for our listeners, just in case you don't know what atrophy means, it basically means like your muscles are deteriorating. So that's a bad thing.
Yeah, it's a bad thing. It's a really, really bad thing.
Yeah. So just to add on a bit more, right? What would you suggest we can do, like just as a general layman person? What can we do to promote better foot and ankle health care so that we can reduce, the risk of injuries, or we don't need to face the cost of physiotherapy, the torture?
Well, first of all, you all need to educate yourself.
The good shoe.
No. You start with at least knowing a bit more, in more depth, the anatomy. Sad to say, I've observed this firsthand myself. A physiotherapy student knows more anatomy than a medical student, because
That's
I understand
true.
that your curriculum nowadays has to be very broad. So, and unless you plan to be a surgeon, normally that amount of anatomy detail is not really necessary for a medical student. But if you really want to be from a very broad perspective, let's say, even if you're a family physician, a general practitioner next time, it's still good to know a bit more detail of the anatomy, understand the importance of physical training, physical fitness. And I think maintaining all these are very important in order for you to have a better quality of life.
Yeah. Okay. Well, thank you so much. We've actually come to the end of the episode. That was a really insightful session. We learned a lot. We had a wonderful time with having a conversation with you, Dr. Low. I hope
I learned so much today.
Yeah, actually. And I hope you guys learned something as well. So maybe you want to continue?
Yes, so before we end, we would just like to again express our gratitude and thanks to Dr. Low for coming in the morning to share his experience and knowledge with us. And I hope the audience has learned something from this session as well. So do keep an eye out for our next episode called Behind the White Coat, where we will be focusing on what it takes to be a doctor. So remember to follow us on AMSA IMU on Instagram and watch out for upcoming events in September. Until then, stay safe and take care. Bye-bye.
Bye-bye.
Bye.